Thank you very much, Mr. Speaker. Speaker, my question is to the Premier. Yesterday, this government's attack on doctors continued. The Minister of Health blamed so-called out-of-control billing by doctors as a reason for his mismanagement. He said doctors are overbilling hundreds of millions of dollars. Is the Minister insinuating that doctors are creating patient demand? Is it not true that doctors are billing for patients for services they have delivered? If the Minister is implying that doctors should deny service to patients to balance the budget, is that not rationing? And if the Minister wants to ration care and prevent patients from accessing care, then why does he just not do that and stop blaming the doctors? Mr. Speaker, why is this government blaming doctors for their inability to manage the health care system?
Thank you very much. Thank you very much, Mr. Speaker, and I know that the Minister of Health and Long-Term Care is going to want to weigh in on this. I just want to say that we very much hope that the Ontario Medical Association, the OMA, will come back to the table, Mr. Speaker. We want to have that conversation. This is a conversation about physician compensation, Mr. Speaker. That's what it's about. I know that there are some who would like to make it about something else, but it is about physician compensation. It's entirely appropriate that the Minister would talk about physician compensation because that's what the discussion is about. We look forward to a productive discussion with the OMA.
Thank you. Supplementary.
Thank you, Mr. Speaker. And Premier, we understand that managing costs is a challenge. But your minister needs to take some leadership, stop playing the blame game in the media, and sit down with doctors and come to an agreement. Back to the Premier, Mr. Speaker. The government has been trying to divide this profession. It's been 2 years since these doctors have had a contract, and in these 2 years, this government has unilaterally slashed doctors' fees to a tune of $815 million. And because of this, clinics have closed, practices have shut down, and doctors have left the province. This government is trying to divide and conquer rather than sit down and negotiate. Mr. Speaker, there are a handful of doctors sitting over there on the government side. Why are they letting their government slander doctors and cut services to patients?
Well, Mr. Speaker, our position hasn't changed at all. What I did yesterday is I implored our doctors through the representation, the OMA, I implored for them to come back to negotiations with us, as I have done many, many times over the past 1 year, more than 1 year, Mr. Speaker. So it's important that we get back to formal negotiations so we can work out an agreement which treats all physicians fairly. But what I was speaking of is how technological changes, for example, have resulted in procedures and services being done much faster in a much more expeditious way than in the past. With cataract surgery, for example, it used to take more than an hour, now it takes less than 20 minutes. We need to make sure that what we're being fair to all physicians, that the compensation that we're providing to them reflects the work that they're doing and values that work. And what happens if we've got certain high billers that are billing in advance of those technological adjustments being made, it's unfair to other doctors like our family doctors, our pediatricians, or psychiatrists, or medical officers of health who are working just as hard, Mr. Speaker.
Thank you. Final supplementary.
Thank you, Speaker. Back to the Premier. Premier, the Minister of Health is in charge. If he thinks that doctors are defrauding the system, he has the power to fix that, not to attack them in the media. Back to the Premier. When the Minister of Health and the government relaunched their attack on doctors yesterday, I found it pretty rich. This is the government that gave us Orange. It gave us e-health. It overspent on smart meters. It's a government that budgeted $40 million to cancel a gas plant that ballooned to over $1 billion. This is a government that's run 9 straight deficits. This is a government that launches baseless attacks to smear doctors. It's disrespectful, but this government just doesn't get it. Mr. Speaker, will the government tell us what the billions of dollars squandered in scandal, waste, and mismanagement could have done for our health care system?
Be seated, please. Minister of Health.
Mr. Speaker, as I mentioned, our position has not changed. We continue to implore the OMA to come back to the negotiating table. We need to and we want to work with them to get an agreement that is fair to all doctors and also helps us continue to provide the excellent care that our primary care physicians and our specialists across this province provide. It's important that they come back to the negotiating table, and to date, over the last year, they've refused to do so. I repeatedly asked them, my ministry has repeatedly asked them to come back to the negotiating table. We believe that there's an agreement that can be found, an agreement that provides us with a sustainable, predictable, increasing budget year after year after year for physician services, but we need the OMA at the negotiating table. I don't know if the member opposite is suggesting they shouldn't come back. We need them at the negotiating table so we can reach an agreement on a fair deal to all doctors.
Thank you. New question? The member from Nipissing.
Thank you. And